Hi, my name is Dr. Jyothi Rao, and I'm here to answer some common questions we get at Shakthi Health and Wellness Center. One of them has to do with insurance and the billing model at Shakthi. First of all, there are two options when people can register, either a year plan or an a la carte pay-as-you-go plan. We are currently not accepting insurance, and but we do give people super bills that you can submit. If you have out-of-network benefits, your insurance companies may reimburse you for those visits. When you decide after the first visit, you have time to decide whether you want to commit to a one-year plan versus a la carte, meaning pay-as-you-go. I favor people doing the yearly plan because there is more access to information. We put out fires before they start. We're not waiting 3 months for the follow-up to try to get all the information. When all of these different moving parts are happening, it just tends to be a lot more confusing. I'm also a primary care doctor to you for the year plan if you need that, because then you can basically call me or talk to me about things that are unrelated to the reason for the initial appointment. For example, if you're coming in for a hormone imbalance, anything outside of the hormone imbalance, you'd have to kind of take back to your primary care doctor. If you get a urinary tract infection, if you get a cold, if you get anything that's outside the scope of the consultation. So I can either function as a primary care provider for that tract or a consultation service provider for that particular question that you're coming in for. If you're coming in to change your performance, for example, because you are an athlete and you want to improve your speed, change your performance, there's a whole track that we do for performance, and maybe you only need to see me a la carte for that reason. However, the first appointment will be the intake and the testing that's ordered, and the next appointment will be to review the testing and create the plan. So know that at least you would want at least 2 appointments in order to start the process, because we can't get any personalized information on you until we've met and decided together what tests seemed reasonable, and then go over those tests at the next appointment. The a la carte version is also helpful for people who are out of state. I hold licenses in multiple states, and you can call our staff to find out which states they are, and that is when you need a primary care. I would prefer you have one in the state that you live in. However, you can still do the one-year plan as long as you have a primary care in that state that you live in. If there's other questions, please call our staff and they can discuss them with you. But we do give super bills, which are a summary of the actual service we provided, and some people can ask for reimbursement from their insurance based on the codes that we put on there and the time that we've spent with you at the appointment. So if there's out-of-network benefits in your insurance and you have fulfilled the deductible, they will pay you back for some of those services. But those are the conversations you probably want to have with your insurance company if you need to before you call us.